Morning, everybody, or good afternoon, depending on where you are. Welcome to this week's ASA Live. I'm Cindy Morris, the Vice President of Development and Community Engagement here at ASA. And I have to just take a minute before we even get started to talk about our social media community and what that means to ASA, because I think that it's particularly fun for me to do these ASA lives. We've talked about it so much that I learn a ton. I'm often talking to people and about topics that I'm learning about as I learn more about aging. But our social media is truly a community. And one of the things that I have grown to value in that space is hearing from everybody on that. And for those of you who have been able to jump into our Instagram page lately, I'm hoping that you are enjoying seeing the new content we are releasing there. We're really working to provide more educational content through our social media channels, in addition to our ASA Live. So I encourage you to take a trip over to Instagram, check out our page over there. I think you'll see there's quite a bit of content there, and really useful content that you can utilize, share, and really use within your own professional work, which is really our goal, is to provide actual content. And as long as we're talking about it, you'll also see on Instagram and all of our social media platforms our student membership drive that is going on right now. Students of any age, students will and can get 50% off of their ASA membership through tomorrow. So make sure that if you are a student, or you know a student, or you like a student, that you share that with them. But let's get started here now. I'm here today with Ofra Paz. I'm excited. She's the Executive Director at DayBreak Adult Care Centers. Welcome, Ofra.
Thank you.
Uh, Before we really start talking about this, I want to let everybody know what DayBreak Adult Care Centers is. You're located in Oakland, California, and you were the 2021 runner-up for the John A. Hartford Foundation's 2021 Business Innovation Award, specifically for your rapid response case management pilot. Um, Talk to me a little bit about what that rapid response case management pilot was, and what was so special about that.
So, the Rapid Response Case Management Pilot is a program designed to address high utilization of emergency systems by older adults for non emergency causes. It actually provides a very intensive case management from the hospital back to the community to be able to stabilize people who are struggling to access the right social and health care in the community and are landing constantly at the ED, where obviously they can't get the adequate care that they need, and they kind of in this ever evolving, revolving door that we know about emergency usage.
Yeah, right. And you all developed this program. What led you to that place?
Okay, so interestingly enough, this program started with Alameda County Emergency Medical Services reaching out to the community of CBOs who have a senior injury prevention program in their mixture of businesses. And Daybreak has one. They wanted us to be part of an initiative that they had to connect older adults who are frequently falling at their home,
Hmm.
to be more on the preventative side and connect them to community-based services, so to address their falls. It was a group of CBOs that started working with EMS, and we developed a whole program with tools, protocols, and everything in place, and we were ready to launch, and we've launched it, and it was a huge failure. uh, yes, I always love telling this story because really the seed for the rapid response actually is a failure. And this is a great lesson for all of us, that we shouldn't give up when we have the right connections and we know that we can do the work together with good partnership. We can always find a way to work something that will be better.
When
And
one
so
door closes, a window opens or something, right? I love it.
exactly,
I love
exactly. That was the approach. And what happened is that we developed a whole tool and embedded the protocol into the EMT's kind of workflow, but we didn't take in count that EMTs are not taking phone numbers from people that they pick up. And we couldn't follow up with them. That was the whole problem. So, and when we did have a phone number to follow up, we were calling people way after the fact and they were saying, "Who are you? What do you want from me? I don't have a problem." And we said, "Okay, so let's go back to the drawing board. We know the people that are calling EMS. We know when they're calling, we know where they're calling from, and we know where they're being picked up to. So why don't we go to the hospital where they're being picked up to and meet them then and there in the midst of crisis and start working with them from there?"
Love that.
And that was the idea, and this made the whole difference and magic. We reached out to the first hospital together with EMS in the county, and they just loved the idea from from the get-go. It made total sense to them. This was something that they really needed. They needed boots on the ground to really connect people from the hospital back to the community.
So you're
And
really providing that link from you've been taken in, now we have the next 90 days to prevent you from coming back.
exactly. So,
Okay.
but the idea here is to really rapidly work with people and respond to the referrals in a very rapid way, because the pace in the hospital is very different than what we know in the community, right?
Mhm.
People need to come in, out. We say either you go up or you go out, right? From the ED. That's the movement. So if you go up to the inpatient, we have a little bit more time to transition you. If you need to go out, you need to go out. We call it yesterday, right?
Yeah,
We have to work like this. So this is the idea here: being very rapid, being very with a very strong presence at the hospital and with the hospital team.
that's fabulous. And so now, what outcomes are you seeing? Because this is I mean, this is not an easy thing that you're talking about doing to move this quickly. So what outcomes are you seeing as you're doing this work?
Yeah, so the real deal here is how we work together, teaming up with the hospitals.
Okay.
Because the idea here is not to do something that is completely external to the hospital, but not being part of the hospital system. Because we need to know that our DNA is the community. We are not the hospital. We are not the emergency side by all means. But what we really need to know is how to work with the emergency side and the hospital. So, and when we do this very rapidly, what happens is that we are breaking the crisis cycle that people are in constantly. And the very intensive intervention, and when I'm saying very intensive, I mean it. It's like,
Mhm.
if we need, we go out and seeing people every day. If that's the thing that will break the cycle, that's what we're doing. So it
Okay.
depends on the case. What we have as a thumb rule is that the depth of the crisis determines the depth of the intervention. So
Mhm.
if it's a huge crisis, we need to push in very hard. If it's a minor one that can be fixed more easily, then we don't need to push much hard.
Okay.
But it depends. And if you want to know about the results, so in the first year of the pilot, we were able to serve 52 clients.
Okay.
From them, we were able to gather data on 36 clients that had a before and after that we could compare. And what we were able to show is that in 83% of the cases, we were able to decrease the ED visits. And in 74% of the cases, we were able to decrease costs at the ED side.
Wow.
For the inpatient side, we had about 69% decrease in the inpatient side, which is, everyone that knows hospitals know that this is where the,
The process.
the cost is. Yeah. And we were able to show a 72% decrease in the inpatient side. And for these 36 clients over a year duration, we were able to show a reduction of over $2 million of costs.
That's
That's
incredible.
stunning. Stunning. But it's not really surprising when you know how healthcare system works and what is the reimbursement rates, and you know how much they pay for each procedure in the hospital.
Well, it's really true. And so, what triggers for me there as I'm listening to you is with 36 patients, we are able to decrease costs by $2 million. Growing this, the cost savings just are exponential.
Yeah.
And that's incredible to think about. So we know there's dollar value in here, but at its core, the clients, your clients, your partners care about the money, but your clients probably don't. What are they really valuing about this program? What are you seeing that's making the difference for them?
We just follow through. We're very persistent. We're present. We understand how deep is the crisis they're in. We understand the level of trauma that they're in. We understand the complexity of their lives. We appreciate the fact that they have a long standing history before we met them. So it's not us showing up and doing our magic. It's about really walking side by side with people who are in deep crisis, understanding what's going on with them, and then gradually developing the care plan that will be something that they can work with us together on. And we have another strong thumb rule is that we never work harder than our clients. So this is this is a lesson learned. We can run around a lot with clients who are saying yes, 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 but actually help rejecting. And when we identify that this is the case, we're pulling back and say, hey, we're here whenever you're ready. But you need to own your life much more than we do. Okay.
Yeah.
So
You can't save everyone. You need to, right? I remember years ago when I was in sales, I gave a training once and I said, you can only, the people to sell to are the people who are looking to buy. And that's exactly the same story here, right?
That's true. That's true. But you also need to build a very strong rapport. And the fact that we're very intensive and we're following through in a very short time helps us build this rapport. When they see that we actually move things, when they see that we find them housing, we are able to connect them to care, we're coming and seeing them every day, we're on the phone with them. The level of rapport that we build very quickly is really strong, and it stays on for the long run. So even after they graduate from the program, if they have a crisis, they can always call us back, and we know them and they know us.
Right.
So we are able to stabilize them again much quicker.
Yeah, that trust you're building, right? You're using the word rapport, but I'm hearing you say they trust us.
Yeah.
And that's a big step, right? Because generally they're working with strangers. If I'm always going to the ED, I'm not working with someone I know, I trust. That's probably a big reason for your success.
Yeah. I think that the relationship is critical for all aspects of it, both at the ED side with the team at the ED. They need to trust us.
Yeah.
The EMS side needs to trust us. All of our partners need to, and the clients. So in a way, it's really building the whole relationship, the whole range of relationship within the community.
And incredible. Do you guys have a client success story? Can you for us?
Yeah, I like telling this story because it demonstrates the power of numbers in this business. And so I will say that we have had a client. She graduated already. She was referred to us by Alameda County EMS. She was the top end utilizer in their system. And during 2020, she had over 250 calls resulting in ED visits. None of them was in the inpatient side, but over 250 calls.
Almost once a day.
Almost once a day. You can imagine that her best friends were Hayward Fire, were all the first responders that were surrounding her, the ambulance company. Everybody knew her very well. They brought us on the case. We assembled an MDT ad hoc forum that for all the agencies that touch this case, and started working with everybody in a very collaborative way. She's a Kaiser member, and so Kaiser was heavily involved at their ED side and their high utilization team. obviously there was a mixture of problems here of behavioral health, chronic diseases. All of it was in a very profound mixture. None of it is simple. I can promise you none of it is simple.
Never is.
But yeah, we started working with her very intensively, going out and seeing her every day. And the goal was to avert her 911 compulsive calling to calling us instead and
Okay.
creating a very strong presence. We worked with her power of attorney. We had a whole team tagging approach to whenever she's dispatching a call, we get a call at the same time. We show up immediately, sometimes together with the first responders to address the call.
Mhm.
We can say that after more than 3 months, we were able to house her again in a more supportive environment where she is really cared for every day and she stopped calling.
Wow.
Amazing.
Wow.
Yeah.
That's incredible. That's
Yeah.
incredible. Creating that stability for her, creating that trusting, a new trusting group of people, right? Because what I imagine was happening was she created her trust base and it was with the EMS.
Yeah, they were best friends with her, definitely.
Yeah.
But being very persistent, making sure that the whole system is coordinated, because this is critical here. If we're doing our thing, but the ED continues to do their thing, we're not gonna go anywhere. If the fire department who responds to her is continuing to do their thing, we're not gonna go anywhere. So we have to pull in everyone to strategize the approach and know how to address the specific client. But the impact is huge. Yeah.
I can imagine. So what are I mean, this just sounds incredible. What are your next steps for RRCM? What's going to happen?
So, January, we actually signed our first contract for the rapid response. We were grant funded up to now. We still
Okay.
have grant funding for this pilot, but we are transitioning slowly but surely to the contracting
Okay.
phase.
Great.
We signed the first contract with Adult Protective Services to provide services for their clients, and this is really a huge step forward. We are in the final designing process of a pilot with Kaiser Permanente, and we will probably launch it in July. And we hope that the success of it will lead to a contracting opportunity. And we are in discussions with healthcare plans about contracting, especially around the new Medi-Cal waiver in California that has enhanced care management as part of it.
I imagine, right? I always wear a few hats here at ASA, and one of them, of course, is development and fundraising. And what I'm hearing you say is we've diversified our income sources as well,
Oh,
which I
that's
love hearing.
that's a game changer. That's a
Mhm.
game changer, especially for a small agency like ours.
Mhm.
Being able to diversify funding streams and not heavily lean just on government grants. Wow, this is a big deal for us.
That's a huge deal. It's a testament to leadership. So congratulations on that,
Thank
because
you so much.
there's nothing more important to a small nonprofit than figuring out how to diversify your
There is one thing that is more important:
what.
an awesome, awesome team.
Yes,
Okay,
I'll give you
this
that.
is the key point here.
Yeah,
And
no,
I will
I
be
love
a
that.
sinner if I will not mention the team, DayBreak's team. This is an amazing group of people who are so passionate and dedicated to the work that they're doing.
I love
They
it.
are the ones to make the difference. I'm the one to show up to live webinars, but they're the ones to actually make the magic work every day, all day for our clients.
Yeah, that's you're 100% right about that. I could not agree more. Having a team as well here that I know I get to show up on live webinars, but you're right. There's a lot of people doing the work. I appreciate hearing that for sure. Period. End of sentence. So let me just ask you, because we are going to, of course, right, want to hear about how does somebody else implement this? Where does this go? I love what just came up. I love hearing about an idea that came from a failed idea, right? So that's got to be the first lesson learned, is that you said it at the beginning, do not give up. It is the best ideas come from failures. We see it all the time in science and in inventions and in all of that. It's also true in our social services. So I love that lesson. But what else? What are some of the lessons learned from this work that other CBOs should be thinking about?
So a critical component for the designing process is outward facing designing.
Yeah.
We are very good at doing the designing internally, kind of making sure that we do our thing. But what we really need to do when we work with health, especially with healthcare systems, and even more at the emergency side, is really understand their DNA, what are they struggling with, their culture, and what will really work for them. Because if we stick with what we know how to do in the way that we traditionally do it, and we don't connect dots, we're not going to go anywhere. So this is one critical aspect of the designing process. The other thing is to understand the value of what you're doing. We need to recognize that there's a strong value to the work that we're doing, and not sell ourselves short, because what we are always doing, and this is our tendency, is to do a lot for very little.
Yeah.
And I'm saying, let's do a lot for a little more, because I'm not saying that we need to go all the way to the healthcare realm,
Right.
but we also need to make sure that we have a viable financial model that can sustain us for the long run. The business model is critical here. And so learning about ROIs, return on investment, pricing models, if you're going with value-based, if you're going with cost plus, these are all things that we have to educate ourselves. And I have to be honest, I'm like a social worker. I don't do business. But I need to educate myself. If I really want to be there and I want to be significant, I want to be making the difference and sustaining the difference that we want to make, we have to educate ourselves to be on the business side. And when we're doing good business, we're doing good service to the people that we are mandated to work with.
Yep. We cannot do anything in any of our work if we do not have the funding to support that. And that is number one to that process, is ensuring that you can fund it. In fact, I'm going to say this, and because I think oftentimes when we are on these ASA Lives, I say, everybody should share this with anybody they know who works in aging, who this can help. This conversation, I would say you need to share this with anyone you know who works in the nonprofit world. Because the lessons you are talking about are not specific to aging by any stretch of the imagination. You are talking about building out strong business systems that will really support any CBO out there, any nonprofit out there. And so not only is the program you created exceptional, but the way you're doing it is making it sustainable, which is exceptional. And there are lessons learned from that. So if you are listening this and you are watching it, share this with anybody you know working in the nonprofit world, because this is a good lesson for us all to hear. But definitely.
One more lesson that I would like to add is partner like crazy.
Partner like crazy.
Make partnership your main strategy. This is your strength. This is your ability. You need to know how to coordinate and be a strong partner to all the range of different entities that are out there, including other CBOs, healthcare systems, anyone and everyone, for-profit, non-profit. You need to know how to be a partner. That's really a strong asset that we have at our end, and without these partnerships, we're getting stuck very quickly.
I'm going to summarize, because what you said in the last few minutes, I could listen to you all day. I'm just going to say it.
I can talk all day. Don't invite me for a whole day.
24 hours a day, we're only talking to you. I'm loving this. But for real, what I just heard you say is, when something fails, don't give up, find the right partners, keep them and have them help you find more right partners, value your team, and actually get what you are worth. I mean, those are kind of the four big lessons that I'm hearing here. And and yes, these concepts have led to this space in which you are having true measurable outcomes in supporting the older adults in your community to really get away from being reliant on that 911 call. But but the reality is those four basic concepts will take you in all directions. So this is
And
amazing.
collect data, collect data,
Collect the data.
collect data. Data
Yeah.
is a game changer. You know, because of the fact that we collected data from the first year of the pilot and we had data from multiple systems, including the hospital, EMS, and our data, we were able to change the conversation. People started listening to us very quickly when they saw the numbers.
Yes. Oh, this is I love this. Um, I thank you, Oprah. For real, we could do this for days. I'm going to invite you back right now. I want to have you back. I want to talk to you
I'll
more.
be here. Let me know when and where.
You got it. I feel like we're going to create a cult following. I really love this. For just as a reminder to everybody who's listening to this, um, we have our next webinar is March 24th. Please remember you can always go to our website, click on events. You'll see the whole list of all of our webinars that are available. Unlike our ASA Lives, you earn CEUs in our webinars. Our ASA Lives are a taste of educational content. So, this is a really good chance to just learn a little bit. Those are going to deep dive. So the next one is the role of CBOs and CBO networks and comprehensive dementia care models, brought to us by US Aging and the ADBI Institute over there. So thank you. I love this. I love this. I love this. I love this. I hope we get you back here very soon. And everybody, have a really great week. If you have not registered for On Aging 2022, our national conference, I'm going to assume it is a horrendous oversight on your part and you just have forgotten to do that. So this is your reminder. It's time. Please do so. onaging.org. You aren't going to want to miss this. This is the type of content you're going to get there, except it's going to be far more in depth. And you're going to get to hug Oprah after talking to her, not just say, okay, let's turn off the computer. So please join us in New Orleans. It's going to be so good to be in person with each other.
And I'm going to be presenting there as well. So I hope to see you there.
And we're going to hug. So we will see everybody there. Thank you all for doing this with us. And we'll see you soon. Bye-bye, everybody.
Bye. Thank you so much.